we've talked a lot about the barriers, which are many. What's on the horizon, or what positive trends have you all seen? And specifically, what are the opportunities? What are some things that are either happening or that are being explored with regard to removing some of these barriers, or all of the barriers that each of you have talked about? So I'll start with you, Dr. Wakelee. Give us some hope.
All right, great. Well, I think there is reason to have hope. Absolutely. There always is reason to have hope. And so many organizations, including ISLC, including ACCC, including NCC. I mean, just, you could name any organization that's involved in cancer care or an education, is really focusing on this issue of making sure that every oncologist knows the importance of doing biomarker testing for patients with non-small cell lung cancer. That we are trying to expand that not just to the oncologists, but also to the folks making the diagnosis, so they can be aware as well. Patient advocacy groups are very engaged in this as well, making sure that when someone is newly diagnosed, if they reach out to an advocacy group, one of the messages they hear is, have you asked about testing? What's happening with the tumor testing? Yeah. The more people who are aware that's a standard of care in treating lung cancer, the more that's going to happen. And then continuing to explore, those financial barriers. And as more agents are FDA approved, or that becomes a preferred first line option, but you only know that if the testing's happened, that leads to campaigning to make sure that the testing is being covered as well. When you can argue this patient isn't getting the FDA approved best care for their cancer because that testing wasn't done, that's a really powerful statement. And I think that's where we're seeing change happening.
That is incredible. Thank you. Thank you so much. I can smile again. What about you, Dr. Boehmer? I know your organization is doing a lot of work in this area. So tell us about some of the advances, some of the improvements in tackling some of these barriers that both of you have elucidated today.
So, Dr. Wakelee, thank you for all of those hope-inducing concepts and methodologies, because I honestly believe that so many of us learn best today by seeing someone like me doing XYZ, so I know I can do it as well. So I think it's about documentation of justification of testing for prior authorization claims. I think it's about working together with the multidisciplinary team, pharmacists, advanced practitioners, oncology certified nurses, to help manage that back and forth with testing and external pathology and laboratory companies to make sure that results show up in the right spot in the electronic health record so that they can be interpreted, shared with patients, communicated and contextualized in real time. I think it's about greater incorporation, as we've seen across so many of our programs, of the tenets of shared clinical decision-making and how to have a meaningful conversation with a patient and or their caregivers about testing and its role on treatment and drug selection and outcomes and progression-free survival. And there are a lot of programs out there that are doing bits of this, or, different points along the continuum. ACCC, for example, building on the research I shared before, recognizes that a lot of community programs don't have kind of operational best practices for how to incorporate biomarker testing into a patient's journey. And so for lung and also, for example, for breast cancer, we're working on creating care pathways which will help multidisciplinary clinician teams integrate discussions of biomarker testing and its impact at various critical time points along a patient's diagnosis to treatment to survivorship or end-of-life care. And those are just examples of us not being overly duplicative, but putting all the resources in one place, talking about timing, talking about when and how to have meaningful conversations, and then doing it with health literate vetted resources and through a lens of equity and shared decision-making, because you look like me, you had success with it, I'm going to do it for my at-risk patients as well, because one, it's the right thing to do. And two, you taught me how to do it. And three, you told me what success looks like so I can measure myself against you. And that's a successful model for scalability.